In today's session, I want to teach what we call nursing common sense. Right, some things that you should know. When you know these things, it should not bother you when you are answering question. Just like I want you to be able to read every unclear question, and you can easily spot something and say, okay, this is not right. Like you don't need to overthink it, right? You don't even need to double think it. You just know it's not right. You know. So that's what I want to do in this session. So let's okay, let me just say, like, I want to give you that ability to be able to read question in a way that you really understand it and you really know this is the right thing to do, this is not what you need to do, right? Yeah, something like that. All right, so let's start now. First question: the nurse has taught a client who has a positive laboratory test result for HIV infection, right? So now there's one thing for the NCLEX to say talking. There's another thing for the NCLEX to say teaching or teach, right? There's another thing for the NCLEX to say taught. Now, the idea behind all these statements is this. Now, when the NCLEX use the keyword talking, it means that the nurse is communicating with a patient, and then the examiner will ask you about that patient statement. Guaranteed. NCLEX is going to test you regarding statement. Now, if the NCLEX use teaching, right? Teaching, whichever. It means that the teaching has not been done. So instead of the NCLEX to test you related to the client statement, NCLEX will start testing you related to what the notes we teach the client. So it will be this time around, it will be what the notes we teach the client. Now, when the NCLEX use thoughts, it means that the teaching has been done. So NCLEX will test you related to the client statement, right? This should be your understanding. So now when I see this particular question and it's saying the nurse has taught a client, right? I already know the teaching has been done. So the next thing I believe the examiner will start testing is related to the client statement. Because after every teaching, you need to evaluate what you said to the patient to see sorry, yeah, to the client here, to see if they got everything correctly or not, so if they have a clear or correct understanding, right? So now let us see, because sometimes the NCLEX can either test you. That's why pay attention to the examiner question. I'm telling you, most students don't pay attention to the examiner question and they select the wrong answer, and I'm like, why do you say that answer is your answer? And they say that's the right thing to teach the client. And I'm like, read the question again, read the examiner question. And they say, oh, which of the following indicates incorrect understanding? And they say, oh, I thought it was correct understanding. Now this is it. NCLEX can either test you on positive answer or test you related to negative answer. That's the reason why you need to pay attention to the examiner question. Don't be so excited because you know the content. A lot of students are like that, right? You feel so excited, you say, okay, I know I can get this question correctly. So you didn't even pay attention to the examiner question because you are over so excited and you are like just going straight to the answer key and you select the answer only for you to know you selected the wrong answer, despite the fact that it might be correct based on what you are thinking, but related to what the examiner is testing is not correct. That's why you need to always pay attention. Is the examiner asking for correct answer? Is the examiner asking for wrong answer? In this case, the examiner is saying which of the following statements by the client would indicate a correct understanding of the teaching. So the examiner is asking for correct answer, right? So now I'm going to look for what correct answer related to what the teaching that was done for a client who have what a positive result for what HIV. You see, it's clear. I don't need to now read the answer key and go back to the question again multiple times, because this is what a lot of students do. When they read the body of the question and they ask them, they read the answer key, it's not clear. They still go back to the answer. They come back. They are going back and forth. They are coming back. Now, if you are that kind of student that keep going back and forth, it means that you've not created a perfect understanding for the question before you went straight to the answer key, which means you are going to be going back, coming back. You will read the question, you will come back to the answer. You read the question, you come back to the answer. That way, it will be difficult for you to pass, because you are going to be lost in every question. You don't want to do that way. You want to understand what the body is testing, what the stem is saying, right? And then what each answer key. And most students always used to read every answer key at a time. No, read the first one first. Decide. Is it a yes? Is it a no? Is it a maybe? If you say yes, then that's your correct answer. If you say no, you eliminate it. If you say maybe, you come back to it. Right. So then go to the next one. Before you go to the next one, before you go to always make a decision before you go. Because if you read every answer at a time, trust me, it's gonna give you a big problem. I'm telling you, you have to just think about this first, make a clear understanding before you go. Because if you mix the thinking with of option one with option two, then you will feel like option two is contradicting option one. Now you will be lost because you will not be able to think straight. You will be thinking, instead of thinking one thing, now you'll be thinking about two things. You will not be like, if the answer number one is saying this, number two is saying this, what's the meaning? You start thinking a lot of things. You start thinking your way out of the question instead of you to be thinking in between the question. Right, because most answer can be so clear that if you read all the answers at once, you can get it correctly. But there are some NCLEX answers that are not clear, that you have to like take your time to talk about each answer first. Right. So that's what I encourage you to do. Right. So let's read the first answer now. The first answer is saying um the viral load the viral load test is used to determine my response to the treatment regimen I am receiving for HIV. Right. Um this look like a correct answer, so I'm going to keep it. Right. It's like a maybe right now because that's my first answer. So I cannot just jump into conclusion and say, oh, that's my answer. No. I have to like look at other answers as well too. You understand? Now the viral load test can rapidly detect HIV specific antibodies in the blood. And this I'm not sure about because how do you detect HIV antibodies? It's not viral load test. Viral load test is used to determine um response, not to uh, detect antibodies. So this I'm going to exit out because this is like a pure no to me, right? So now number three, I will be able to decrease the dosage of my prescribed medication if my viral load is low. Now, this is one thing I want you to know in pharmacology. Pharmacology, we don't tell patients to decrease their dosage. We don't it's wrong, like it's totally wrong. So if you see this anywhere whereby the patient is saying I would decrease, no, let me even tell you some things that are wrong to decrease, like decrease the amount of testing. Whether you are trying to test for your blood sugar level, you are trying to check your blood pressure, like anything that involves checking if you are feeling okay or not, and you are saying you want to decrease the amount of time that you want to be doing that kind of test, it's wrong. Or you are trying to decrease the amount of time you are taking your medication, you are trying to decrease the dose, those things are wrong. So this is definitely wrong. Now, I am unlikely to develop AIDS if my viral load is high, right? That is also what are they calling it? A wrong understanding, right? As well too, because yeah, your viral load can be high and you can still develop it. It depends on how you are managing the situation. So this is also a wrong statement. So now since we've x 2 3 4, we're left with one. So definitely one is the answer, right? So yeah, these are just normal understanding related to HIV. So if you are having difficulty with this question, be honest with yourself. The problem is not your ability not to be able to answer the question. The problem is you lack the content knowledge. That is just it. Because what the question is saying, right? Because it seems when I was reading the question earlier on, I only stopped at infection. I skipped the aspect that said the client is scheduled for viral load test. So the NCLEX is testing you related to viral load test. It's not really testing you related to HIV. It's testing you related to viral load test. But it's viral load test under what? HIV. So it's trying to test your knowledge related to viral load. And also, if you want to know what the NCLEX is testing, look at the question. You know, I always used to do this. I call it the reverse engineering, right? So you can see viral load, viral load, viral load, viral load. So it's always there. If you've been following me all through, you will notice that this is how I always used to know what the examiner is testing. So I will not be lost in the question and be saying, "Oh, is the question testing me about HIV? Is the question testing me about viral load?" No, I always used to know what the examiner is testing me. I don't used to be lost. I always know the focus. Your answer key can tell you the focus. That's why I always used to tell you the body of your question contain what the content examiner is testing you. The stem is the examiner question. Your answer keys give you extra understanding about the question so that you can pick your answer smartly. So it's asking you, do we use viral loads to determine response to treatment, which is 100% correct? Also, do you use viral load to determine antibodies? Obviously, no, we don't do that. Right. Do we decrease our dosage? He said, I will be able to decrease my dosage of prescribed medication if my viral load is low. Definitely, we don't decrease dosage. Right. And also, I am unlikely to develop AIDS if my viral load is high. Definitely, it depends on how the patient is managing their condition. They can get to the point of having what AIDS and their viral load will still be high. So, it's viral load is not a guarantee for a patient not to develop what AIDS. So yes, that understanding is wrong. So the correct understanding is what? One. You see? Right. This is how you start thinking like a nurse that is going to pass the NCLEX exam a minimum question, right, without not struggling through any question. Now let's move to the next question right here. This is also going to be very interesting, trust me. Now let's go. The nurse is planning care for a client who has an aviations in the left arm, right? Now, which of the following interventions should the nurse include in the client plan of care? So, we are trying to what? Include. Now, this is it. When NCLEX is testing you related to planning care, it's always intervention every time. Anytime you are planning care, it means that we are trying to what? Put a certain intervention. So, you need to look at it. So, you don't even need to think about interventions because NCLEX has provided 4 different interventions. The only thing is that 3 of the intervention can be wrong. Not even can be wrong. It depends on the question that the examiner is asking, right? If the examiner is asking for correct intervention, then it means that 3 intervention will be wrong. 1 is going to be right. Now, but if NCLEX is asking for incorrect intervention, it means that 1 of the intervention will be the wrong intervention and 3 will be right. So you need to select wrong. Right. So yeah, that's just it. But in this case, let's see what the examiner is asking. The examiner is saying which of the following interventions should you not include. So it's asking for a good intervention to include because obviously, if you are to plan care for clients who have what AV shunt in the left arm, and the examiner is asking you to include intervention, you have to include the correct intervention. You don't want to cause problem to the patient, right? So yeah, you are looking for the correct intervention. So meaning we have 3 incorrect intervention and just 1 correct intervention. So let's spot it out. Right, brilliant nurses. I know you can do this. So let's do this, right? You are definitely a brilliant nurse. So let's do this. Now read alongside with me. Now instruct the client to protect the AV shunt by tucking the left arm under the body while sleeping. What do you feel is wrong about that statement? You are telling the client to protect the AV shunt, but you are telling them to put it under their arm. Now, if you ask yourself, if you don't even have AV shunt and then you sleep under your arm for a long period of time, how do you feel about it? You feel like you have loss of circulation. Now, if a patient have AV shunt, right, the left arm, right, because this is talking about the left arm, same left arm they have the AV shunt, and you are talking the left arm under your body. Guess what? It also can stop the circulation, cause problem to the shunt, and then destroy it. Right? So, do you want to include that into the plan of care? Definitely no. Right? You see, it's not until you know the right thing. At least you just want to think and ask yourself, this don't really make sense. You understand? So yeah, out. There's no fancy rationale because this is why I see a lot of tutor do. They just give you fancy rationale, make no sense, make you try to look like you need to think a kind of special way before you can be able to answer a question. No, most of the way of thinking related to nursing is just the little thing you can just think about that just make the biggest sense. Right now, 2, check for beauty by palpating the aviations. So there's 2 things we always used to do, right? We but in this case, the NCLEX is testing you for beauty. Now ask yourself, how do we test for beauty? Ask yourself, how do we do that? Right? We don't palpate to check for beauty, right? We don't prepare to check for this, right? How do we check it out? We check it out by using our stethoscope, right? That is how we check for this. To listen to it, we don't palpate, we listen to it. So this as well too is a wrong understanding. Oh, sorry, it's not even a wrong intervention. The question is not asking for understanding, it's asking for intervention, right? So now three, administer prescribed intravenous fluid through the AV shunt. Now there's one thing they always used to say: don't put any medication in there. It's just like blood transfusion, right? The blood transfusion, don't put any medication while doing the transfusion. Don't do that. Right. Same thing with this as well too. Avisions, no medication. Right. So this is wrong. You can see now. This is what I always used to teach students. Right. The moment you can X out three answer and you are left with one answer, there's no thinking again you need, because you've done perfect thinking to eliminate answer one, two, three, and then you are left with one. So what are you thinking about again? It only means that the answer is correct. Now let's read it. Avoid obtaining blood pressure measurement in the arm with AV shunt. Yes, that is true. That is true. We even not only for this, right? Not only for this, we do this in three ways, right? This is one way that we try to avoid taking blood pressure measurement, right? This one way. If a patient have AV shunt, there's other ways as well too that we avoid obtaining blood pressure. If a patient have IV access in that particular arm, right, we don't take blood pressure in that arm. Also, if they have IV fluid going on in that particular arm, we don't take blood pressure, right? That is another. This is one way. This is two. This is three. Now four. Four. Okay, for stroke patients or any patient that have weakness weakness in a particular arm, we don't take blood pressure in that arm. So yeah, these are the key ones I remember for now. Right. So yes, you understand what I'm saying, right? So yes, this is just normal way of thinking without no any fancy way of thinking through your question. You need to always feel relaxed to answer every unclear question, and trust me, the answers are something you can easily figure out. Right. Now let's move to the next question. Right. So yeah, this is also interesting, right? Now the nurse is caring for a client who has a prescription for an intravenous infusion of 0.45 sodium chloride. The nurse notes the client is receiving 5% dextrose. So what's going on right here? The patient have this prescription. This is what the patient should receive. But when the nurse saw the nurse saw that the patient is now receiving this. So instead of receiving this, now this is normal nursing thinking. Anytime you notice that a patient is receiving wrong treatment, the first thing you are doing is to assess the patient. I don't care what the question want to test me, but I know that is always the first thing. When I was answering this question, I already know the answer is to assess, because that is the normal principle. That is how a nurse should react when a patient is getting wrong treatment. Assess. So now, when I saw the examiner saying, which of the following actions should the nurse take first? Now, this is it. I want to explain this first keyword because a lot of students get lost when the NCLEX say first. Now, there's difference between which of the client should you see first, and there's difference between the NCLEX saying which of the following actions should you take first. Right. When the NCLEX is saying first, right, don't bother to say one answer is wrong. No, every answer is correct. Because I'm saying this because most of them will say, why is it that every answer are correct? The keyword always is to guide you. It's not, that's why I always say it's not like nursing school question. Nursing school question, yes, some answer can be wrong, some answer can be correct. But on the NCLEX, the keyword we direct is the examiner question that we direct you what to do. It's not the answer that you want to focus on. Many students don't understand the question. That's the reason why they misinterpret the answers. The NCLEX is not trying to tell you to say this is wrong to do, this is wrong to do, this is wrong to do. No, because if you are thinking this is wrong to do, guess what? You'll be saying, but the patient is receiving the wrong treatment. Why can I not change it? You say, or should I notify the healthcare provider? I notify the healthcare provider is true because the healthcare provider that created that prescription. Oh, should I complete incident report because it's obviously an incident? Oh, maybe this can be the answer too. Oh, assess the client. Should I assess the client? You will be lost because every answers are correct. So it's not about the answer is every answer is correct. If the NCLEX is trying to tell you everything, when NCLEX use this kind of keyword force, it means that everything is correct, right? If NCLEX also use the keyword priority, it means that everything is also correct. If NCLEX use the keyword best, everything is correct. If NCLEX use the keyword most, everything is correct. All these keywords don't tell you that all the answers are wrong. It's only just trying to tell you do something first. We know everything is important for you to do, but let's just decide the first thing to do based on this client situation. What is the best thing to do? Everything is a better thing to do, but let's look for the best one. Priority means everything is important for you to carry out, but let's look for the priority right now based on the client situation. Now, most as well too, everything is important, but let's look for the most important. You see, so that is how you think through and clear questions so that you don't get lost, right? So that you don't get lost. It is the reason why a lot of students say every answer seem correct on the exam. I always used to laugh when I hear students say something like that. Like, it's obviously clear. It's just that you are focusing on strategy. You are not focusing on understanding the question. Strategy don't give you understanding of the question. You need to understand the question. There's no shortcut to success. That's the reason why you complain every answer seem correct, when in reality the answer don't seem correct. When in reality the answers are written like in that form, but the only thing that is important is the examiner question that clarify what you need to do. Right. Now, if you are thinking about clients should you see first, it means that NCLEX is going to give you 4 different clients. So the first right here is different from the first right here. The first right here is related to 4 different clients. The first right here is related to action. You understand? It's related to action. So now the first action you always need to do, right? I don't even care what the NCLEX have right here. Me, I just know when there's always a wrong treatment given, the first thing is to confirm that the patient is stable. You can deal with any other thing later, but that patient that is now receiving that wrong treatment, man, the thing you want to do is to find out, is that patient what stable? Right. So that's the main reason why the answer is 4. You need to assess that client first, right? Hope you are learning, right? Because I want to be able to walk you through a process in a way that you have this smart way of thinking, right? You can be able to defeat any question on the exam. I don't want you to be defeated by the question. I want you to defeat the question. And this is how I want you to think in a way that you can be able to pass in minimum NCLEX question, right? So let's proceed to the next question. The nurse is observing a newly hired nurse administer a client transdermal patch, right? So in this question, the nurse is not even caring at all. Instead, the nurse is what observing a newly hired nurse. So she's observing another nurse administering what transdermal pouch. Now, see something. Since the nurse is observing, that keyword observing, go and check any question related to observing, right? It's always one of these two things. Is either the NCLEX will test you for what the either nurse staff member is doing correctly or what they are doing wrong. So you need to pay attention to the examiner question to know if the NCLEX examiner is testing you related to a correct thing the staff member or nurse is doing or the wrong thing. Now look at what the examiner is saying. The examiner is saying the nurse should intervene if the newly hired nurse is observed. Now, why do you want to intervene in the first place? You want to intervene because you don't intervene if the nurse is doing everything the right way that she needs to do it. You only intervene when there's a problem. So it means that there's a problem right here. That is the reason why we are trying to intervene into the situation. Right. Because at the end of the day, if we are observing the staff member and the staff member is doing everything right, all I just need to just tell the staff member is, great, you did a great job, right? Simple. But now if I'm trying to intervene, it means that there's a problem. So let us look for the problem. Now, the first thing the newly hired nurse did was to instruct the client to avoid massaging the pouch, which obviously, yes, we want to tell, um related to this, we want to tell the patient not to massage the pouch. So I don't need to intervene. I'm going to definitely tell the hired nurse that you did a great job with that with that aspect. Now, look at number two: cleaning the client's skin with soap and water after removing the old pouch. Right? Definitely, yes. We want to clean that area after removing the old pouch with soap and water. That is very true. So I don't need to intervene. Good job, newly hired nurse. Now, next three. Uh, she placed her initials in the pouch, and she wrote the date and time the pouch was applied on, right, applied on the pouch, which is good. You really want to document when you apply the patch. You want to make sure you put your initials, you write the date and time, right, so that um that's a good way of documenting what you did, right? So this is a good job, right? Good job done. You see, just like the previous question we answered, we've X out number one, we've X out number two, we've X out number three. So there's no point of thinking about the last one. You see what I'm trying to say, right? If you have the ability to eliminate properly, you don't need to doubt your last answer, right? It's always the answer, right? Now, you see, and that's what I'm trying to teach in this session, right? Now, omitting documentation. We never in nursing omit documentation. You want to always document everything. So why do you want to omit the documentation? Omitting documentation is that you skip to document what you need to document. It's a wrong thing in nursing. After carrying every care, we need to document. We need to document it, right? So that is the reason why number four is the answer. That's the thing I'm going to intervene. I'll say, oh, newly hired nurse, anytime you carry out all your care, you need to document it, right? So yeah, it's not even about all this information. It's about the fact that she omitted documentation, right? It's not about all this information. It's about she omit, right? So yeah, that is it. So, but if this answer have to, if this answer was like, let us say, let us say it's a different question entirely, and then one of the answer now said document about the location, the client body where the patch was placed, without not putting this omitting, right? This is going to be a correct answer, right? It's going to be a correct answer. But the fact that they put omitting, it means that, oh no, we should not omit, right? So that's why the answer is what, four, right? I hope you are enjoying this process. Now let's answer the last question. This is also going to be very interesting. Now I'll walk you through the nursing thinking process. So let's think as a nurse. Are you ready? Okay. Now this is your body, right? Anytime you're answering case study chat question, this is your body, this is your stem, right? And all this part as well is your body. This is your body. They still fall under the body because they give you this audio description related to you waiting for what the examiner is going to test you. Am I making sense? Okay. All right. So let's read the question together. Now let's start with the body, right? Because a lot of students will start right here. I'm like, no, let's try to understand the body first before we go. You don't read that manner, right? You want to understand the body first before you go to the stem. Right. So the nurse in the psychiatric unit has completed a morning assessment of the client. So what is the nurse doing? Assessment. Now let us see the assessment. Now, day two, right? 8:30, she said the patient is withdrawn. Now, anytime you are reading assessment data, you want to note everything that is wrong. That is the main reason why you are reading assessment data. It's just like if you've taken over a shift from another nurse, what you are trying to note from a nursing note or is nursing note is the things that are wrong about the patient, what have been done to help those kind of situation, right? So now this withdrawn is not a good thing for the patient. They said remain in assigned room. So this is not really a problem. They remain in assigned room. It's not a problem. They said exhibiting blunt. So I'm going to just put blunt, blunted, okay, blunted affects and jumbled. You can see. I don't even need to write it because I know I'm going to like skip to the I have the rest of the question in other tab. But you can see withdrawn right here, blunted, affected, jumble, illogical speech. They are wrong, things I need to pay attention to. Experiencing auditory hallucination, paranoid delusion. They are very important. Now let us see history. What's in the history and physical. Now the history is all about the psychiatric. Right? They said third admission this year. Okay, for acute sign and symptom of schizophrenia. So we know the patient diagnosis. Earlier we did not know. We just right. That's the problem. Now you see, most students try to know the diagnosis to their question. You are not a doctor, for crying out loud. You are not a doctor. Read your question like a nurse. You don't need a diagnosis to be able to answer your question. If NCLEX provide you the diagnosis, fine. If they do not provide you the diagnosis, you can still answer the question. As a nurse, we deal with nursing diagnosis, for crying out loud. I'm seeing most students, they are going to start studying more than 50 medical diagnoses because they want to prepare for case study, chat question, bow tie question. No, you can still be able to answer the question without not knowing all that. NCLEX did not make your question for you to go and be cramming diagnosis. No, if you read through the question, your answer is in the question. Just follow through the question. You'll be able, like, if you are trying to do case study, bow tie, chat question, your answer is in the question. You just need to have a good critical thinking ability to be able to think through the question and be able to pick out the answer. You will see the answer to this question is in this question. You will see. Let's break the question down. You will see that the answer is in this question. I don't need to think about anything. The answer is in this question. You see, when I check the progress notes, the only thing I just paid attention to is the problem of the client. And so far, so good. There is nothing documented in the nursing note that anything has been done towards the problem. Because when there's a problem, we are also trying to look at, okay, these are the problem of the client. Has the nurse done anything as at yet for the client? But I'm not seeing anything. It's only the problem. Day 2, 8:30, the nurse only documented the patient problem. Now, the physical aspect of the client, the history and physical aspect is that they said this is the client third admission this year for what? Acute sign of and symptom of schizophrenia, which also show that yes, they are showing this sign. You can see the sign right here. So of schizophrenia, right? I don't need to start asking myself, oh, is this a sign of schizophrenia? Are they withdrawn? I'm like, wow. So you still have to think about it when it is clear that the history and physical is stating that that is the authority of having those signs. No, you don't need to think about it. It's a continuation of what the progress note. It's just the nurse trying to tell you based on the physical and history assessment. This is the third admission this year for sign and symptoms of schizophrenia. I say, oh, okay. So the reason why they are withdrawn, blunt affect, having logical speech, hallucination is because they have schizophrenia. Yes. Now in nursing school, yes, for sure we know sign of schizophrenia. So when you were even reading the progress note, you might have been thinking about it and saying, "Oh, is this patient having schizophrenia?" Yes, you can still be thinking about it, but you don't necessarily need to know the diagnosis. You don't necessarily because most students at this point they will start saying, "So what does this mean? The patient is having?" They will start thinking about it. You don't need to think about it. You don't. You are not a doctor. You are a nurse. The only thing I just need to think about right here is that my patient is unstable. That's all. My patient is unstable. That's what I just need to just know right here. And I know I need to do something. But I need to read the question to let me know what I need to do. Right? But I'm still trying to figure out the body of the question first. So, but to God we have it, the NCLEX decided to give us a diagnosis, which is fine. If it is case study, if you are answering case study question, right? If you answer case study question, the NCLEX will give you the diagnosis when you are answering, when you get to generating solution. When you get to the generating solution, sometimes NCLEX will give you the diagnosis, sometimes NCLEX will give you the hints of the diagnosis, right? It depends. Or sometimes NCLEX, yeah, sometimes, but many of the time NCLEX will give you the diagnosis. Let's say you answer 3 case study question. 2 of your question might we have what? The diagnosis, all can have the diagnosis, but sometimes I don't just know how to explain the other part whereby NCLEX don't give the diagnosis. It's not that they skip the diagnosis, but the problem at that point, what they are trying to treat, the doctor did not diagnose the patient. Instead, they just diagnose a particular acute situation whereby we are just trying to fix it. So you don't need any diagnosis. Just we are just trying to fix acute situation. But if it's A diagnosis related, NCLEX will give you the diagnosis when you get to generate solution. Case study is your clinical judgment, right? Where you have your recognizing clue, analyzing the clue, prioritizing hypothesis, generating solution, taking action, and then evaluation. The six item, one, two, three, four, five, six. You see? So if you understand how case study work, you can answer any kind of case study without even cramming or studying medical conditions, because you don't need it. The case study have been written in a certain format that the answers are already in the question. You just need to understand the case study to be able to apply the right answer. I'm telling you the truth. That's the reason why when most students learn case study under me, they are able to understand it perfectly. They are like, wow, I've not learned this before this way in my life, because most people complicate it. Most program complicate the understanding. Most tutor complicate the understanding. Right? They don't make it look like nursing way of thinking. They make it look like you need to think outside the box to be able to get your answer. That's the reason why most students are left with no choice than to go and be learning many disease conditions. Most students would say the more disease condition you practice related to case study, the more you have the ability to answer the question. That is not true. You can answer the question even if you've not practiced a lot of disease condition. Yeah, for sure. But you definitely need knowledge of disease condition to answer the question. But not like because of its case study, you now need to now go extra mile. No, your med-surg knowledge is enough. Just leave it like that. If you watch my video related to case study, you will definitely be able to understand how to answer case study. You will definitely be able to understand how to answer chat question, and you will 100% definitely be able to answer what both eye question. Right. So these are the NGN NCLEX questions. So let's proceed. Right. So the last part, which is the order. Now, based on the progress note, symptom, the history, patient have schizophrenia, and now order is now saying we should do two things. We should make the client attend what? Group session when they are stabilized. You see the keyword. Make the client attend group session when they are stabilized. Second order is to give their medication as well too. So that's the two things we have. Okay, but our patient is definitely not stabilized right now. They have problem according to the progress note. So I feel what we need to do, it depends on what the examiner is asking. So let's see what the examiner is asking. So the examiner is saying which of the following interventions should the nurse take next, right? So encourage the client to attend one group session today. Obviously, the doctor said we should only make the patient attend group session when they are stabilized. So I feel we are not going to do this because my patient, there's no anywhere in the progress note history that they say the patient is stable. The patient is not stable currently, right? So guess what? This is 8:30, and the last note as well too is 8:30. Patient so far so good. No new documentation that said patient is stable. So obviously patient is not stable. So why should I send them to a group session when the doctor said we should send them when they are stable? Now look at the next one. Teach the client. You can see as I'm thinking the question. You can see I'm not thinking the answer outside the question. I'm looking at what I have to answer the question. That is how case study is. That is how both eye question is. That is how chat question is. You see, try answering those kind of questions the way I'm answering those kind of questions. You see, you are going to improve in your way of thinking. Right. There are still some certain things that you might be missing out that I did not mention here. But guess what? With the little knowledge you have right here, if you start answering case study question, chat question, both eye question, you will not start seeing that you are making smart decisions. You will not start saying, oh, so I don't even really need to know what I was knowing before. I have the ability to still answer the question, right? Try it, you will see. Right. And thank me later. Now, see, look at number two, right? Teach the client, family member about how to prevent a relapse. Right now, patient is not stable. Now, look at the form of treatment, because most times students don't know how to think through care. We call something we call this care. Obviously, everybody know care. I don't need to explain care. Now, we have a patient that was brought to the unit, right? Right? We completed assessment on the patient. Patient is not yet stable, right? We've not given any form of treatment to the patient that is not stable. How do you now want to skip all this process and then go to teaching? For patient that is not stable, when do you teach? Ask yourself that question. Patient is not stable and you want to start teaching. No, teaching is the last thing to do. When the patient is totally fine, that's when you teach. So before you are thinking about selecting teaching answer, ask yourself: is this patient stable? We are dealing with a patient that is not stable, and the next action you are thinking to take is to teach the patient. Have you cared for your patient? Have you given the necessary thing you need to do for the patient? And you are saying you want to teach? No, right? Some people will be thinking about it. I understand. Most people are thinking about it and like, should I teach the client? Should I teach the family member? They don't even know where to connect the thinking. You see, I've been able to help you to connect the thinking right now. You see how I'm able to break it. Your tutor is not going to do this for you, right? People online, YouTube, Asha, you what? They don't teach like this. They don't tell you this kind of smart thinking. Instead, I don't just know how most people think. Most of the time, they tend to just throw away their thinking outside the box and they tell you, yeah, so. And like, these are complicated way of teaching. Bring students to the manner of care so that they can be able to have the ability to think about it. You see how I'm able to help you to think about this option. I did not give you any crazy rationale. Instead, I told you, let's think about it this way. You have a patient that presented in the unit, right? You completed assessment and you notice that the patient is not stable. Nowhere in the whole body of the question that said you've completed a treatment. So why would teaching be the next thing for you to do? A patient is not stable and you are calling the family member to teach them. Does that make any sense? It's just like now you have a patient that present to the unit with shortness of breath. This is your assessment. You saw that the patient is having shortness of breath, and the NCLEX is asking you what is the next thing to do, and you are saying the next thing to do is to teach the family member how they can avoid shortness of breath. Patient is still having shortness of breath. You are teaching the family member how to avoid shortness of breath. Does that make any sense? No. Okay. Right. Yeah. Thank me later. Now see. Look at number 3. Right. Number 3 is saying administer the prescribed dose of the medication, which even if I don't know the medication, I feel like right now, what the kind of answer I'm looking for is the particular answer that I need to treat the patient's condition, because the doctor gave a specific instruction in the order, which is for the client to attend. What are they calling it? The session. This is the two things I need to do for the patient. As a nurse, you always carry your doctor order, right? If you start working as a nurse, you need to carry every order that the doctor has provided. So I feel like, because what I'm looking for is treatment, because the doctor said they must attend their session when they are stabilized. So in order to make them attend their session when they are stabilized, I need to do a specific treatment. The only treatment the NCLEX, the order have is this treatment right here. So, and this treatment is related to this particular treatment. So I feel like this will be my possible answer. Well, I've not read number 4, so I need to, you know, I don't need to feel so excited and then say, oh, let me select the answer. Now look at number 4. Now tell me that you did not say the answer is number 4. Please tell me that you did not say the answer is number 4. Please. Please. Tell me you did not say the answer is number 4. Because number 4 is sending you straight back to number 3 and is telling you that number 3 is the answer. Please just tell me you did not say the answer is number 4. Yes, if you are thinking about number 2, I can still forgive you. But if you are telling me the answer is number 4, just confess and just let me know. Confess and let me know. Because see, number 4 is saying you should prepare for discharge, right? Prepare to discharge the client to community treatment program. Patient is not stable and you want to discharge the client. Patient is not patient came to you. You need to stabilize the client before you discharge them. That is, look at it. Even to go to group session, the doctor is telling you that you should make them stable before you take them to group session. So you will not tell me you are discharging your client to community? Nah. This is definitely wrong. This is definitely wrong. So definitely, the answer is 3. Now, have I been able to help you out in thinking through the NCLEX question? This is my goal for you. I want to make you a dangerous test taker. I keep saying this. A way that the NCLEX is going to be so scared of you, right? I want to give you the ability to be able to pass the NCLEX exam in minimum question, right? You should not struggle no more when you are trying to answer NCLEX question. The thinking process is clear. You just need to understand how is the person thinking, because everybody come on the internet to show you how to answer question. Most of the time they don't show you how to think about it. You see, I walk you through how to think about number 4, the answer for number 4. I walk you through how to think about the answer for number 2, I'm not just giving you rationale and say because of so you should not do so. No, I give you a thinking process in a way that even if you see another question, you don't need a special rationale. Instead, you need a thinking process, because what we help you on the exam is a thinking process. There are some certain things that will be different from what I, I have made mention in this whole tutorial. But at the end of the day, when you go on the NCLEX exam, it's not what you are seeing differently on the exam that will matter. It's the thinking process that will matter. It's the thinking process that will help you out. That's the reason why most students will go on the NCLEX exam and say, "Oh, I've not seen most of this question before. I don't know how to answer it." If you don't know how to answer a question, it's because you depended on a specific what process, which is your ability to just know which answer is right and which answer is wrong using rational way of thinking, because that's what you get stuck with. Question bank, they only give you rationale for what is right and what is wrong. They don't give you thinking process. But if you learn the knowledge involved, right, the way the person is critically thinking, then you definitely can use that same thinking process and be able to answer this question. Now, one thing I want to challenge you with is this: go and look for any chat question, go and look for any case study question, go and look for any botai question. You are going to see that you are going to improve greatly. Trust me, you are going to see, using the same thinking process, walking yourself through the same thinking process without no stress, no pressure. One thing I want you to do is this: don't be scared to select your answer. It's okay to get it. It's okay to get the answer wrong, right? It's okay. You don't need to like give yourself problem and say, oh, because one thing I always used to see is, I'm not sure the answer is I'm thinking. You don't, please don't do like that to yourself, right? The old training that you are going through for 60 days is because you want to be confident, you want to avoid anxiety. And the training for avoiding anxiety and being confident starts today, right? Not on the day of the exam. If you don't start training yourself to pick answer without not overthinking it, trust me, you on the exam you will do the same thing. All these things add up. You can finish a good coaching program and still end up failing because you did not help your thinking process. Sometimes it's the student that cause it on themselves. I know all these things. That's the reason why every time I speak to all those little area that people don't pay attention that make them fail the exam. Right. So when you are selecting answer, you are not taking the NCLEX exam. Select your answer with confidence. You are not taking the NCLEX exam now. So this is the time for you to train yourself. Train your way of selecting answer with confidence. When I was always answering questions, I don't care. I don't double think myself. I just say, okay, this is my answer. If I get it wrong, I'll say, oh, okay, I got it wrong. And I'm going to check why the mistake I did. Now, let me tell you what I wish you to do. On the NCLEX exam, you have 2 minutes per question. I wish you to answer my question within 30 seconds. Right. Because you can either fail your answer in 30 seconds and you can either fail your answer in 5 minutes. I've seen a particular student that spent 5 minutes on a particular question. She did not get the question correctly. And me in 30 seconds, I did not also get the question correctly as well too. So the truth is, if you did not get the question correctly in 30 seconds and 5 minutes, me, I have saved myself 4 minutes and 30 seconds more to learn other valuable thing. But you have wasted what? 4 minutes, 30 seconds that you can also use for valuable thing. That is how I trained myself in a way that I always used to answer question in 30 seconds. So now, that way, I now always used to ask myself, what clue did I miss out in 30 seconds that made me to get that question wrong? So I start paying attention to the clue. I said, oh, okay, if I've been able to pay attention to this clue, I would have gotten this question correctly. So next time I don't make that mistake again. So that way I keep training myself until I have that ability. That's the reason why in 30 seconds you will see me, I'm able to answer question right. I'm able to answer question right. So it does not stop me from getting that question incorrectly. But at the end of the day, the ability to be smart with your decision matters a lot. That's the main reason why I don't want you to be saying, oh, should I say the answer is stereo? Should I select one answer? You've done your critical thinking related to the answer, select it. If it is wrong, let that wrong answer teach you the right way to think. Right? Don't wait. You cannot force yourself to get answer correctly. You've done your thinking, you've done your best in thinking it. Select your answer. If you get the answer incorrect, then learn why you got the answer incorrectly, and always try to practice time management. NCLEX allow you to answer one question within 2 minutes. If it's your case study, item one, they want you to answer it within 2 minutes. Item two within 2 minutes. So be smart with your way of thinking. It's going to help you on the NCLEX exam. It's going to help you on your NCLEX exam. So yeah, this is what I want to give to you: the ability to be able to critically think, right, and be able to pass the exam successfully. So if you are struggling, right, to pass the NCLEX exam, right, and you need someone to coach you in order to pass the NCLEX exam, right, I can coach you in the next 60 days. So imagine what you've learned today. Awesome, you appreciate it, you love it, is you feel like you should be in this certain environment and be able to, and you feel like, oh, if you are to do this for the next 60 days, guess what, you are going to know a lot, you are going to learn a lot, right? So now, if that's how you are thinking, right, I want you to work with me for the next 60 days. My coaching price is $497, right, for 60 days. Most students pay this in full, and most students use payment plan. You just have to pay 250 now, and then tell me when you are going to pay the remaining 250 dollars. So I want you to text me right now. I'm going to put my number on the screen, right? Plus 1767 613 0769. So text me right now. I created this complaint in order to help you. If you are struggling, if you failed the NCLEX exam multiple times, if this is your first time and you want to make sure that you are taking the NCLEX exam and not retaking it again, right? Trust me, that's why I created this complaint, in order to help you to succeed. Right. And definitely, once you join the coaching program, you'll be able to pass your NCLEX exam in minimum questions. So text me. You can either text me on WhatsApp, you can text me iMessage, right? Whichever way, just make it possible to reach out to me, and then I'll be able to help you through the process in passing the NCLEX exam successfully. So I'm going to see you in my next video.